Welcome and thank you for joining us today on the Leadership Café, where we talk to extraordinary people leading remarkable businesses. We're your hosts. I'm Richard Citron.
And I'm Michael Couch. During these interesting and challenging times that we're all experiencing, the disruptions we're going through, we've found it to be very enlightening to turn to some of our finest leaders across the country and find out how they're handling all this, how they're directing their businesses, leading their employees and teams, and particularly contributing to their communities to help make everything run just a little bit better.
Before we get too far along, though, Michael, we want to make sure and thank our sponsor, Vaco, a global talent solutions company. We are grateful for their support of the Leadership Cafe. So today, our very special guest is Geoffrey Hall. Geoffrey is CEO of the Cleveland Clinic Rehab Hospitals. These series of acute care rehab hospitals are committed to providing comprehensive physical medicine and rehabilitation services to folks who need help to transition back to full living back in the community and more, as has happened in this pandemic. So Geoffrey, welcome to the Leadership Cafe, and thank you so much for joining us.
Thank you. It's a pleasure.
Hey, so we always like to start off by asking you to tell us a little bit about your background, how you got to be where you are, and of course, we'd like to hear more about the Cleveland Clinic Rehab Hospitals, what you guys are up to.
Sure. I have been Chief Executive Officer of our Cleveland Clinic Rehab Hospital in Akron, Ohio, now for 4 years. And prior to this position, I had the great opportunity and pleasure to be a part of the Rusk Rehabilitation Hospital as part of the NYU Health System in New York City.
Wow.
That was certainly a top 10 ranked rehab hospital for the country, and one of the oldest rehab hospitals in the country and world. And in that setting, I had a lot of opportunity to work collaboratively with physicians and physician scientists and researchers. And then drawing from that experience, this opportunity to work as part of Cleveland Clinic in a joint ventureship with Select Medical to build out this brand new building and open this building, and then of course provide rehab care. My background is actually, I have a master's in social work and also a master's in business. So certainly I was attracted to healthcare just with the spirit of helping people and trying to make a difference. And as a lot of what happens in healthcare, when you have a clinical focus, you have supervisory and leadership opportunities. I've been leading and running hospitals and large departments within hospitals for the past 21 years.
Right. Well, it's just like we see with all of the great leaders that we've talked to here on the cafe. Careers are never a straight line. It seems a lot of interesting variety of experiences, a lot of challenges that you've had to navigate. But it sounds like the experience you went through with the NYU system is one that was most meaningful for you.
Yeah, the experience at Rusk as part of the NYU system really was transformational. It really kind of changed the horizon of that conversation of good to great, and really focusing on exceptional patient care, really doing top level recruitment of talent and retention of talent. As you know, the New York system, or New York City health system, is very competitive with top ranked hospitals across the world. And that's very similar to here, Cleveland Clinic, where they expect to be the best, they expect to be world class, and to be part of an environment that operates 24 hours a day, 7 days a week, and with the expectation that it provides the highest and best world-class care. So it kind of changes how you try to relate to people, how you build high-performing teams, the importance of communication, so that everybody is focused on the same page and the same direction, being able to use data to make improvement and drive decisions. But ultimately, it's about who you surround yourself with and how you invest and build up that talent because in a complex setting like this, not one person can do everything.
Oh,
Well, you are speaking our language. I can tell you that, and I love your description of course, Jim Collins is good to great metaphor in your examples of communication and recruitment and retention and having people who are already highly motivated understand the mission and the strategy of the organization. These are all things that, if leaders can put in place, it makes their job, I think, a lot easier to accomplish and implement the strategy, certainly. So that's fantastic. Great experience.
Yeah.
Can you talk a little bit about the work of the hospitals and what you've been seeing, particularly in relationship to the pandemic, the disruptions that's been causing, and in healthcare as well?
Yeah.
Certainly whereas we've seen certainly some non-essential services, I'm sure hip and knee replacements have diminished. That's probably impacted your census, but unfortunately, strokes don't go away. So
Right.
that's part of your client population. What else have you guys done to kind of address this? What have you seen in relationship to your to the pandemic?
Sure. That's a really great question. So obviously the pandemic has impacted everything, and it's impacted how we have recruited and staff and filled open positions. It's how we've had to become a lot more flexible in how we accommodate our staff. One of the challenges I have here at this location, for example, is with the pandemic resulting in numerous school closures, and there's that has directly impacted my workforce. So where our hospital sits, we're surrounded by 5 counties, and each of those counties has a different return to school pathway. So some of it is in person, some of it is virtual. But when you're trying to build a team and maintain consistent operations with staffing, very suddenly my nurses, my therapists were on a day-by-day basis, not knowing if their child was going to go back to school, if that was going to impact their ability to come to work, was that going to cost them their job? So we've had, while hospitals certainly can't have the benefit of working from home, it's forced us to be a lot more flexible about how we support and encourage our staff. So we had some people that moved from weekday schedules into weekend schedules. We had some people that moved to later hours or alternate hours. Really just trying to, if COVID has taught me anything, it's that need for flexibility because things are going to change. It has also really changed our communication strategies. And there were times in the height of the pandemic in the first part of March and April where information was coming out so fast that we would put out a directive in the morning, and then the policy, procedure, safety protocol had changed by the afternoon. So we had to deploy kind of a multi-tiered approach just to be an effective communication across the building, which included brief daily huddles, both at the start and end of the day. We assigned our key leaders to actually do walking rounds through the hospital to communicate in one-to-one and small group sessions.
wow.
My housekeepers and my food service and my ancillary staff, people who don't have those clinical backgrounds, they were scared of COVID. They didn't understand. There were so many headlines that just created anxiety with people. So my physicians and my nursing leadership, my leadership team really had to kind of create these town hall environments where people felt safe to ask questions, and my doctors were explaining to my housekeepers how to use personal protective equipment and PPE. And it's been gratifying in the sense that our staff has come back and said, we were really scared during this time, but the extra communication and the one-to-one touch and the small group touch really made us feel safe. And I would say that that's probably my biggest takeaway. I mean, we're definitely, we have seen an impact on the business, but as you said, strokes don't go away. So where we started to serve our community here was really focusing on creating safe COVID care for individuals with stroke or individuals recovering from a brain injury or individuals with COVID that also had a spinal cord injury. So really focusing on area of expertise and our way to contribute. But certainly we had to put a lot of new precautions and workflow and process to create a safe environment. And I'm very thankful that because of those precautions, we've not had any type of staff outbreak or patient outbreak. And for the time period when we were asked by Cleveland Clinic to run a COVID unit, 100% of our patients that we served with COVID were able to successfully discharge home and return to life. So a lot of success, but I can't even underscore the amount of communication, literally daily, by the hour sometimes, to make that happen.
Well, that's great. We participated with some colleagues in some global research during the pandemic on how employees were perceiving the communications or how their companies were handling the situation. Overall, people were very pleased with the communications they're receiving. What they were saying, though, is we didn't feel like we had an opportunity to speak. Our voices weren't being heard. So really impressed by your focus on down to one-on-one, regular, daily, constant communication, and not only talking, but listening too. So sounds like that made a real difference.
Yeah, in healthcare, when you have an event like that, you activate what you call your hospital incident command center.
Yes. Yep.
And you really delegate to people to go outside of their job descriptions and their roles. And this person is in charge of giving communication to the patients. This person is in charge of giving communication to this unit or floor. And we were operating in that command center model for almost 3 months, 7 days a week. And there were daily conference calls with Cleveland Clinic, with other hospitals in the area, with the hospital association in the area. Of course, at one point there was a lot of statewide coordination of PPE resources. So we would delegate people to those scheduled meetings, calls, and activities. But we were trying to keep people fresh, so we would rotate people in and out. So really, you can't ask people to operate at that high adrenaline level 7 days a week without a break. So if I was on call for the weekend, then the next weekend somebody else would take the conference calls and then report off to the group. So a lot of coordination, but you're right. You still, the most important thing is that the people on the front lines feel like they understand the why of what you're doing, and they feel safe to ask questions. And that actually made some of our processes better. It's just that openness to staff asking questions and seeking clarification, which then allowed me to say, okay, I need this doctor to go speak to this group, or this nurse would be helpful to this group. So it really, I think that's probably one of our better takeaways from COVID. Certainly it's been a heavy thing to deal with all year, but improved communication, thinking about who the audience is, not just relying on an email. Sometimes it was in person, or sometimes it was a group text, or it was walking rounds with a small group of staff. There was a variety of tools that we did with that. And then the other thing, and I would say this is a positive too for healthcare in general, is the openness now to using telemedicine and using telehealth. I myself personally have had some telehealth appointments, and the opportunity to speak as we're speaking now, and really intimately with the doctor, versus waiting in a crowded waiting area. The appointment travel to and from. So the use of technology to make healthcare more accessible is going to be a silver lining when we're
absolutely
on the other side of this, but you still have to make it about that personal experience.
Yes. Yeah, that the technology has made a difference in a variety of ways, as we've heard. Anything. So the other theme that we're hearing here on the Café is that it's maybe not just how we reacted, but how we had prepared in the past. And maybe not even know there was going to be a pandemic, but we've done a lot of things to build flexibility, agility, to have technology. Sounds like that was a key for the rehab hospital too.
Yeah, absolutely. So we, for example, for a period of time, we had to restrict all visitors, and visitors were such a big part of our patients' recovery and support system.
Yeah.
So we had to start using things like Microsoft Teams and Zoom and FaceTime to do virtual family training, where we still needed their caregivers to participate with us, but we had to think and reinvent how we did that. We've certainly changed our inventory of masks and gowns and eyewear. And it's right now the standard in healthcare, at least in our setting, is every single one of our caregivers is wearing a mask 100% of the time while they're providing patient care. We're encouraging eyewear. We certainly are encouraging PPE to keep people safe, and the temperature screening and the workflow of how you arrive your team. And then, because we're not done with this, things could still change very quickly. So if there was a big surge in the area, it might impact future visitation or student rotations or all of these things. So just creating kind of a flexible, agile, up-to-date communication structure where as new information comes in, you can push that out very quickly and then validate that with how are you feeling, what did you hear, those kinds of things. So I'm lucky in that, but we're always trying to think about how we are messaging this. And that was one of my big lessons learned is for a while, I think I got so focused on the message to my staff that I needed to take a step back and also consider the message that was going to the patient that we were currently served and their family members who couldn't come in and visit. So how could we increase that communication back to that family so they knew how their loved one was doing?
Yes. So, Geoffrey, I want to ask you a question about, and perhaps you've addressed it, but I want to be targeted on this. I was talking to a client the other day, and he was telling me that he's a senior leader in an organization that's been working very hard. They're a manufacturing group, and last month was October was some mental health month days, and the team was instructed to have a mental health discussion. So he invited his boss in, and during the discussion, his boss said, "Listen, I know you're all under a lot of stress, but too bad. It's not going to give up. You better just learn to and get on with it because we're not going to be slowing down." And we had unfortunately, a kind of a sick laugh about that. Boss didn't have any perspective about this. Healthcare workers are perhaps, the most dedicated, most diligent in their work, and certainly have been under the greatest stress as first-line workers. What do you tell your team? What do you see in your team? And also, what do you see for yourself? We haven't talked about very much, Michael, about how CEOs take care of themselves in these situations. What are you doing for your own self-care?
Yeah, that's great. So I could go on and on about that topic because
you're
a social
I'm spending
worker.
a lot of time thinking about our resilience and our ability to handle stress. And our response was very different in March and April. And now as we get into the fall and into October, my biggest fear is people's complacency. The initial shock and headline, we've gotten used to that. We've gotten used to some of the precautions that we put in place, but people want to see their families. People want to see their grandkids. They want to be able to go out with their friends, going to a football game or going to a school function. And there's so many activities of life that has kind of been stripped back that it does impact people. And we've had to give, our team, our leadership team and our staff permission to say that they're feeling stressed and that they need support. And we even changed how we started to interact with people. Instead of asking, "How are you today?" which you could hear any number of answers, but usually not very substantive. And just instead asking, "How can we support you today?" And I really do believe in healthcare where the connection to what we do is so close that if my staff feel happy and supported, then I should expect my patients to feel satisfied. And so I use patient satisfaction in my setting as a barometer to tell me how my staff feel. Because if my staff feel cared for, then my staff are engaged and they feel supported. If I start to see my patient satisfaction slip, then it tells me to take a step back and do a check-in with my team. You asked how I was dealing with this, and there's a couple of coping strategies I would say, but there was a period of time where I was working every day, and I did that for almost 2.5 months.
Mm.
So the first thing I had to do was schedule some time off and trust other people to step up and be leaders. The other thing that I had to do is I really had to kind of take myself offline for a while. I think it becomes too convenient to spend so much time scrolling through the news and the headlines. And when you're just saturated with nothing but bad news, it affects your sleep, it affects your attention span, it affects your relationships. So I did have to give myself permission to not check the news every 10 minutes and do that. And just on a personal level, I started listening to audiobooks and podcasts, and I just wanted to kind of change the channel. So my work was so intensive and it required me to be on all the time that I just wanted that freedom of like an audiobook or something that wasn't work related that could recharge me a little bit. So that certainly helped.
That's great. That's great. Thank you.
Talked with a CEO who decided to learn the guitar right now, and another executive, a female who decided to pick up the ukulele. Picked up her kid's ukulele and found. I like that your point about changing the channel. I think that's some great advice.
Yeah.
For folks.
Yeah.
Well, we could go on talking, all afternoon, and I think the first thing I want to do is say thank you to you guys.
Yes.
We were at a health facility today earlier, and the kindness that my wife as a patient was being showed is just phenomenal. Again, and we just can't believe what those frontline workers are going through every day. So thank you, and thank you on those respects.
Thank you.
One of the things we've tried to do too, to sort of change the channel, is to ask a different question. So a lot of us have been asked, what's the pandemic done to you? And as long as it's appropriate and it hasn't impacted your family in any terrible fashion. The other question we're asking is, well, what has the pandemic done for you? And is there anything that comes to mind with that question?
I mean, honestly, it certainly has impacted me. But if anything, it's reinforced all of those things in addition to work that are also important. So spending time with family, the ability to just enjoy being outdoors and do activities that are both safe and responsible. So my wife and I took a camping trip as a socially distanced vacation this year. And it was a different kind of trip or travel than we had taken in the past. But it was so much more rewarding and satisfying and possibly even more relaxing because we weren't trying to do something when we went somewhere. We were just trying to enjoy where we were. So less of the travel agenda and more of just focus on family and creating a memory and finding something, even if it was a brief change of scenery, it was just that opportunity to just say, I really like being quarantined with you and making that family connection even stronger.
Exactly. Yeah, we did the same thing. It took a week and went to a place where we normally spend every day running all over the place, trying to find stuff to do, being out in the boat. We sat on the back porch for almost the whole week, and I loved it. I absolutely loved it. Yeah.
I think my wife and I have spent more time eating dinner out on our side porch.
Yes. Yeah.
And just enjoying homemade cooked food and spending time together than I wouldn't say. I mean, it's certainly a noticeable increase because we had nowhere else to go. We weren't going to restaurants. We weren't going out into the community. So we just kind of rediscovered maybe some underutilized areas in our own space.
Yeah, I love it.
Yeah,
great.
Well, we've got a pot of chili cooking on downstairs. So
all right, you're ready. You're ready.
Having that a little bit for sure.
My wife made vegetable soup today, so well, thank you again, Geoffrey. It's been very enlightening and very educational as well. So we want to thank you for being on the Cafe again, and to recognize that, we'll Richard and I, when we get a chance to get together face to face, we'll sign a copy of our new book that just came out this year on strategy-driven leadership.
That would be fantastic. I look forward to reading that.
Great. Right. Well, again, we want to thank our sponsors, Vaco, who help us meet all these fantastic people who are doing remarkable things, and particularly we want to thank Michelle Jarzowski, who's behind the scenes making all the things run. Well, these our podcasts come out every Thursday, and you can find them on Richard's website, on my website, at the vaco.com website as well, and as well as they'll be posted on LinkedIn, Spotify, and places like Pocket Cast. So, for all of us at the Leadership Cafe, thanks those of you who are joining us and listening to Geoffrey's insights, and it was great again speaking with you, Geoffrey. I'm Michael Couch,
and I'm Richard Citron, and we look forward to connecting you with you on the next Leadership Cafe. Geoffrey, thank you so much.
Thanks a lot.
Thank you.